Well, thank you, Mr. Speaker. When it comes to children in care, there is a complex web of legislation, different accountabilities and funding from various levels of government overlaid with privacy concerns. Now, all of this, I hope, is focused on the well-being of Alberta's children. Now, unfortunately, as questions about Serenity's former kinship care family have been debated this week, the minister hasn't helped the situation by her lack of disclosure. To the Minister of Children's Services, now, I'm not asking you to break any privacy laws, but your responses have left too many unanswered questions. Now, there's an unfortunate perception that you're using privacy as an excuse for inaction. What are you going to do to change that perception?
The Honourable Minister.
Thank you, Mr. Speaker. And Mr. Speaker, I understand that this is a very complex situation, and there's some frustration at the lack of being able to access that information. And so, again, Mr. Speaker, while I understand the frustration on behalf of members and other Albertans, Mr. Speaker, I have to be incredibly careful and respectful of the young people who are involved in any complex and delicate and sensitive situation. And my primary directive is to protect those youth, Mr. Speaker. So while I understand the frustration of the member, absolutely I can say I am ensuring the safety of those children.
Thank you, Honourable Minister. First supplemental.
Well, thank you, Mr. Speaker. Now, the first phase of the Ministerial Panel on Child Intervention resulted in 7 recommendations, including to improve information sharing, which I believe would go a long way towards helping the minister provide timely information to Albertans and restoring public confidence in the system. The panel also recommended changes to streamline and speed up the child death review process and enhance supports for families. The panel chair confirmed on April 19th that there would be legislation brought forward this spring to implement the Phase 1 recommendations. Again to the minister, will we see this legislation this spring, and if so, will it enact all 7 of the panel's recommendations?
Honourable Minister.
Thank you, Mr. Speaker, and thank you to the member for the question. Absolutely, the panel did fantastic work. I'm very thankful for the recommendations that they came forward in terms of improving the child death review process. And so, Mr. Speaker, absolutely, I took those recommendations very seriously, and we're working very hard with my legislative team to look at legislation as well as potential changes to policies and procedures and regulations. Mr. Speaker, clearly there was change required, and again, there was excellent work done, and I look forward to making those changes in the very near future.
Second supplemental.
Thank you, Mr. Speaker. The panel was created to prevent tragedies like what happened to Serenity from ever happening again. And the only way to restore Albertans' trust in the system is for this panel to be given the tools we need to do a comprehensive review. That means we need access to the information about what happened to Serenity. Now, I think I speak for all panel members when I say we would be willing to sign whatever agreements are necessary for us to see the specific files and to review those files in strictly closed sessions. Again to the minister, will you grant us access to the information we need to do our job so we can prevent tragedies like this from ever happening again?
The Honourable Minister.
Thank you, Mr. Speaker. And certainly, I think it's very important that the panel have all the tools that they require in order to be able to make the recommendations to improve the child intervention system. So, Mr. Speaker, I will continue to support working with the panel to ensure they have access to the information that they require in order to do that. Because, Mr. Speaker, clearly we need to know how to improve the system, and clearly they need access to all the information that they require. So, Mr. Speaker, absolutely, I will continue to work with them to give them access to all the information I can to support their ability to do so.